I've recently posted a number of conversations on my YouTube channel as well as my Wheat Belly blog and my Undoctored blog on the concept that triglycerides can serve as a very useful gauge of the very low density lipoprotein particles, VLDL particles in your bloodstream that really underlie heart disease risk. Not this ridiculous, silly idea of LDL cholesterol, the cholesterol in the low density lipoprotein fraction as a very indirect and crude gauge of heart disease risk. A far better gauge is VLDL particles that you can measure directly via such methods as an NMR lipoprotein analysis, but even on a basic cholesterol panel. A lot of the information on basic cholesterol panel is absolutely useless. The total cholesterol is garbage. LDL cholesterol is a wildly inaccurate value that very poorly reflects heart disease risk. But there is, buried in that mess, some good information. The triglycerides, in particular, are a very good piece of information because they reflect the number of VLDL particles quite well. And why is that important? Because VLDL particles lead to a whole cascade of effects that lead to small LDL particles. It distorts the behavior and size of HDL particles and has some other effects that all lead to heart disease. So you have this triglyceride value that's a wonderful measure of VLDL particles in your bloodstream. But what if you start with a high level, like 500, and I aim for 60 milligrams per deciliter or less, not the 150 milligrams per deciliter, often quoted as normal, because even at 150 or 130 or 125, you still have oodles of VLDL particles, small LDL particles, and distorted HDL behavior. So I aim for 60 milligrams per deciliter or less. Well, how do you get your triglycerides down that low? If you start at, say, something like 500 milligrams per deciliter, which is very high. Well, I've done this many, many times. For about 18 years, I consulted on what's called complex hyperlipidemias. These are people with triglycerides of 2,000, HDLs of 15, very, very peculiar, bizarre, often genetically determined patterns. I'll tell you, this works. It's virtually foolproof if you follow through on all these steps. So let's take a hypothetical person who starts with a triglyceride level of 500 milligrams per deciliter, meaning they have a flood of VLDL particles causing small LDL particles. It caused HDL to be very, very low. So a common accompaniment to a triglyceride level of 500 is an HDL of maybe 25 or 27, which means very low HDL, very high risk for heart disease and also suggests that you have metabolic syndrome and or type 2 diabetes and fatty liver. There's a whole cluster of things that occur with too many VLDL particles in triglycerides. So let's say a person starts with 500 milligrams per deciliter of triglycerides. They go wheat and grain free, as we do in my Wheat Belly and Undoctored lifestyles, and we also cap net carbs at 15 grams or less per meal. You do that, and a triglyceride level will typically drop to maybe 170, 150, something like that. We add omega-3 fatty acids at the true therapeutic dose of 3,600 milligrams of EPA and DHA per day from fish oil only, not krill, not linoleic acid from flaxseed, only fish oil. And that reduces it, say, to about 92 or 105. Then we take steps to normalize insulin sensitivity. Those are all the other components of my programs. Vitamin D restoration, normalization or optimization of thyroid status, including iodine supplementation, magnesium supplementation, and finally, cultivation of bowel flora. All those factors lead to restoration of insulin sensitivity, and that drops triglyceride further. And all the steps we take to normalize bowel flora, such as eradication of small intestinal bacterial overgrowth or fungal overgrowth, that even has larger effects. End effect is a triglyceride level of about 40 or 45 or 52. It's very common, it's the rule. We get triglycerides down by following these very natural and logical sequence of strategies. It's not tough. How often do you need a drug to reduce it? In my experience, never. Never. The drugs are ridiculous. They hardly work at all. They're very expensive, full of side effects, yet you can do it naturally and very, very inexpensively just by following this logical sequence.